some
Actually,
point,
your muscles.
and I am just
Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. Tonight we're joined by Dr. Galate Aga, who is our Chief of Informatics at San Antonio Metro Health, and she is the queen of data here in our Metro Health operations. So glad to have her with us. And this is our COVID-19 update for the San Antonio community. We are reporting tonight 191 new cases of COVID-19, which brings the total to 44,456 in our community since the pandemic began. Our 7-day moving average has dropped a bit too, which is now at 143 new cases per day. Unfortunately, we have a number of new deaths to report tonight as we continue to go through the verification process on those cases reported to us by the state. We have a total now of 656 who have passed since this pandemic began, verified deaths in our community. These occurred between, the new deaths, the 19 reported tonight, occurred between July 13th and August 17th. 10 of those are after reviewing death certificates reported to Metro Health by the state, which verified the death. And again, Metro Health verified those deaths are COVID-19 related. Now, I'd like to go into some of the demographic information, and this is some of the work that Dr. Aga has done for us. Demographics of these cases and deaths help us with the understanding beyond the numbers, which also helps us understand why we can't let our guard down. And keep in mind, those numbers that are reported tonight are a loved one lost, a life well lived, mothers, fathers, daughters, uncles, neighbors, colleagues, and certainly friends. So with regard to the demographic data in these cases, over the last couple of months, things have changed. The number of cases in children has increased by double what it was 2 months ago, and that is true for cases overall as well as those in the hospital. In mid-June, the number of children with COVID-19 hospitalizations was about 1.1 of the total hospitalizations. That number has doubled as well, which is now at 3.7%. Total cases in the hospital are now pediatric. Roughly 12% of total cases are those of people under 19 years old. 66% of deaths are Latinos in our community. That is up 6% since we started tabulating those, so that has risen. And also, more than 65% of those who have passed away had at least one known underlying condition. This is important because as you go about your daily activities, you might not know if the person next to you is more vulnerable to the severe effects of COVID-19. And that's why it's important to wear your mask, keep your physical distancing 6 feet away from others at all times, and a reminder that we all need to do our part to protect each other. And again, underlying health conditions are very, very common, can range from diabetes to high cholesterol, so we need to keep our guard up. Finally, over in the hospitals tonight, we're reporting 546 cases, or excuse me, 546 people in the hospital. That's down 23 from yesterday. 50 new admissions to the hospitals overnight, as well as 247 of those in ICU. That's down 8 from yesterday, and 162 on ventilators, down 22. In terms of capacity, 56% of ventilators are available, as well as 14% of staff hospital beds. Let me turn it over to Judge Wolff.
Yeah, thanks, Mayor. And some of those certainly moving right with respect to the hospitalizations. You know, one thing we always talk about, how many people we lose and how many may be in a hospital, but there's also a lot of people that have long complications a long time after they've been cured of COVID. Like today, we still have over 80 patients in long-term assisted care that have COVID that still have the impact of what they had. So when you get it, you don't necessarily get over it, depending on how bad it is or what condition you were when you got it. The report that you gave with respect to the doubling of the 18 and younger pediatric care issues that we're facing, it's beginning to show somewhat. Over in the Bernie School District, within the first 5 days, they've had 5 cases and some 60 possible exposures there. And so now as we get closer and closer to September the 8th, which is not that far away, we're going to have to be extremely careful because of the more young people getting it and then more young people getting in the hospital. I think we had one that passed away, wasn't it, that was below 18. So we're going to have to be ready for that. Tragedy still continues to hit public sector. Mayor Al Suarez of Converse has been a friend for a long, long time, and just today, or actually yesterday, the Converse Fire Department announced that Captain Brian Anderson, a 16-year veteran in the fire department, lost his life due to COVID. So it can strike anywhere, anytime, any age. So as the mayor said, mask. By the way, I have a mask and a scarf, so I'm really double protected. Mask, social distance, sanitation, don't get in real big, large groups. We'll work our way through this.
All right. Thank you, Judge Wolff. And as always, you can see the latest data on COVID-19 in our community by going to the website, covid19.sanantonio.gov, or by texting COSAGov to 55000. Myself, Dr. Gaga, as well as Judge Wolff are available for questions.
Dr. Aga, do you have any more details about these children that are in the hospital? How many had underlying conditions, and what are their statuses tonight?
So I think we've reported on that in the past. I don't have the numbers exactly for this week, but I do remember that in the last report that we gave, we said that one of the most common conditions we saw was asthma. The number is pretty low in terms of what underlying condition stands out, but obesity and asthma, I think, are one thing that stood out the last time we looked at the pediatric hospitalized cases that have data on underlying conditions.
Has any local school districts reported positive COVID-19 cases? And if so, does Metro Health have those numbers?
At this moment, I'm not sure of that. I think Dr. Kurian or Dr. Wu would be able to better answer that in terms of what the local school numbers are.
So would you know if what happens if school districts don't follow the rules of reporting these cases and putting it on their website?
So I'm not sure about the consequences, but I do know that the amended health directive requires all public, charter, and private schools to report COVID-19 data to Metro Health and school districts to post the aggregate data on their website when in-person learning does begin. So the health directive did not define the way the data that might be presented on the district's websites, and that decision should be at the district level, but can certainly be done at the individual school level as well.
So does that mean that districts can split up the cases, or they report all of it together?
So again, it can be aggregate data, and I think the way that it's presented can be up to the directive of the school districts.
If we can go back to the numbers again with the doubling in cases in children, just to make sure I'm understanding this. So it was in June, it was 1.1%, and this is for, when we say pediatric cases, is it 19 and younger or 18 and younger?
When we say pediatric, we mean 17 or younger. So pediatric technical definition means under 18.
Okay, so under 18.
Yeah.
And so in June it was 1.1%, and then you said it doubled. So from June to now?
Yep. So what it means is, of all the people who were hospitalized at that time 2 months ago, I think it was 1.1 or 1.3%.
1.8.
1.8%. 1.8% of total hospitalized were pediatrics. Now it's about 3.7%. So that's a doubling of the proportion of total hospitalized that are pediatric cases.
Mayor and Judge, can you react to that? Just give us a little context. I mean, as we're talking about schools and seeing that that rate has doubled.
Well, it's a scary number. I know that everybody's watching some of these school districts that kind of jumped ahead of the September the 8th to see what they're doing, to see what measures we should be taking here. But, you know, we always thought that high schools would be the more dangerous point. But now we see young kids getting it too. So it's going to take a really, really important effort once they physically start going back to school to keep control of this. And I'm not sure what the school districts at this time are learning as they watch Bernie and Comal District open and as cases begin to occur. But I would guess no matter what we do, when schools do open, and there's going to be a lot of kids going back to school here before too long, that something's going to happen. Somebody's going to get it.
Yeah, and to me it's concerning because, you know, this is still a new virus that we're learning a lot about, and you know, we're learning every day. 3 months ago, a lot of the conversation was about how young people didn't seem to be affected. Well, now we've seen a doubling of the cases of young people, and not only that, a doubling of the cases that are severe. And what's even more concerning to me is that, it appears when a young person goes to the hospital, and there's more and more of those every month, every week, when a young person goes to the hospital with COVID-19, they're going in without any apparent underlying conditions. And the threat of a severe complication is not anything that a parent wants to, think about with regard to COVID-19.
With doing investigations on these cases, do we know where these children are getting COVID-19 or contracting COVID-19?
So actually, I did look at the data for this to see what their source of exposure was for the pediatric hospitalized. And again, a lot of the time it depends on how much data we have on the cases, because sometimes we can't do a full case investigation to get that level of detail. But for the majority, in the way that we define source of exposure, it's close contact, meaning that they were in contact with someone who's known to be a suspected case.
I understand in our deaths today we do have a pediatric death. Do we know anything about that?
Go ahead.
So, based on the data that we have, I think we have one death in the 0 to 9 group, and I think one death in the 10 to 17 group. So the numbers that I have is in the 0 to 9 group, we have 1 death. In the 10 to 19, we have 2. And as of the past couple of weeks, we've been verifying the data. In the 20 to 29 group, we have 6 deaths. That's up 2 from 2 to 3 weeks ago that we reported when there was only 4.
And I think, Henry, you're referring to the report of a new death tonight under 18. Yeah, we're waiting for more information on that particular case in terms of exact age and things like that. And if we can share it, we will.
So we don't have the exact age for tonight.
No, I don't. Sorry.
Right.
Do you have the age ranges of the pediatric patients that are hospitalized with COVID?
We do. It's a small number, so I don't think we're reporting that, just the exact ages. In the meantime, it's just the age ranges that we're playing. Like I said, the 0 to 9, the 10 to 19, and the 20 to 29. So we break it down in 10-year age groups right now.
Across the state, there's currently a backlog of about 500,000 tests that need to get processed. And it's my understanding that part of the backlog is because private labs send them to the state, which sends them to y'all, and then y'all have to check them and send them back to the state. And meanwhile, we've seen officials in Collin and Denton come out and say that they don't have any confidence in the state's numbers. Do you feel the same way? And I guess, can you kind of address what that backlog means for your department and handling all of these cases and case investigations and stuff like that?
Absolutely. So the backlog is a challenge, and I think it has made it to the news. I'm not sure if you're referring to the coding error that was done with the Walgreens. We did see that, and that made it to the news, yes. And so that led to a release of 59,000 tests what we call our data dumps into the system. And we do get that from time to time. All I can tell you is it's not as simple as saying whether we have confidence or not in the data, but this is part of why we're working 14 hours a day to process that data, to catch any errors and validate that. So just the process of deduplicating takes us an entire team of 10-hour work a day so that we can be sure that what we're reporting to you has been refined, groomed, and gleaned to get a more reasonable number. So the honest truth is, yes, there is a lot to be cleaned. There is a lot of technical things that we work through, but we do work closely with the state, and they've made themselves very available when we run into problems. We have meetings multiple times a week and address these issues to put the daily numbers that are out there make sense. They're not a duplicate. They're not a repeat case. So it is challenging, but that's why we work around the clock. Data validation is a round-the-clock effort.
And if I may add to that, there has been such a high level of a high standard for precision and accuracy for the data that we report to you. Part of the challenge is that this stuff is moving so quickly and people's expectations have changed on what kind of data they want to see. Not to mention the fact that, the differences in some of the numbers being reported by the state that we have to verify. And we didn't even talk about antigen tests, for instance. But a lot of this is moving very quickly, and there is zero national standard for reporting. And so what you might see in one city is different than what you might see in another. But we have made, we've made it very clear that the numbers that we want to report are accurate, that they're transparent, and that if someone is looking at those numbers, there's a good explanation for what they're seeing.
Can you clarify how many deaths are still under investigation as of today?
I think it was on.
Yeah, 1 second.
It's reported on the website every single day. I don't have the number memorized, but we always post how many became confirmed by the day, how many are still pending, and how many the state is reporting so far.
Yeah. Ours says 257 under investigation.
Thank you, Mayor.
Going back to the pediatric death, do we know if this person had underlying conditions, or if how long they were in the hospital for?
We don't have any more granular information than what
At
was
this
reported. It was reported there was some underlying health conditions in this particular case.
We'll know a lot more. And again, the turnaround, we just find out about these, and then we have to investigate and find as much information.
But if I may, there's always this, and I'm speaking as just a citizen observer, there's been a focus on what is underlying health condition. But keep in mind, an underlying health condition can be diabetes, it can be hypertension, it can be high cholesterol. And so you go out on the street and ask somebody who has one of those symptoms, and there is a lot of people, if not, I wouldn't venture to guess, maybe a majority, if not much more, a much higher number. But, the point being, even if you're the healthiest person on earth, don't assume you're immune to COVID-19.
I really want to reiterate that, because when you asked me about how many had underlying conditions, it was really a low number, even with the asthma being the most. Many of these don't have documented health conditions. So it really reiterates what the mayor says about the fact that there's no guarantee that just because you're a child or a young person and that you don't have an underlying health condition, that you are completely free from the severity. It increases your risk, of course, but with children also, we don't necessarily fully yet know how this virus reacts in children, right? We had the inflammatory syndrome that was showing up for a bit, so it's not a direct, prediction, and that's what makes it scary.
And the corollary to that, though, just to be careful, because I know a lot of families and children are even watching this program, you don't have to be afraid of it. It's so easy to protect yourself. Just wear a mask and keep away from crowds and keep distance between yourself and other people that aren't in your house. It's real easy. You don't have to be scared of this, but we have to do some common sense things.
With the breakdown of that pediatric death, you mentioned there were 2 deaths between 10 to 19 and 1 between 0 and 9.
Keep in mind, this is data up until a few days ago. We always do our analyses at the end of the week because we have to process data on 40, the number of cases that are out there today. So what I was reporting does not include the new one that was reported today.
Going back to the schools and the health directive, do you have any information about the 7-person COVID-19 teams that will be put together at each school district?
At this time, I do not. I think Dr. Wu will be able to talk about that really well when she's back on.
This is getting back to the state's numbers, sorry. Do y'all happen to know how many backlog tests you folks have had to deal with and how far that backlog goes back? And then do you trust the numbers that the state is currently putting out right now?
At this time, I don't know. We've had a couple of data dumps, which is when we know a backlog is being thrown into the system. And again, it's not a simple answer to say whether I trust or not. We process our own numbers after verifying what the state gives to our jurisdiction. So we trust our numbers. And for the most part, there is, correlation. But really, I'll be honest, I haven't looked at the state numbers. We are just preoccupied with processing the data that we have to put out our numbers after verifying everything we get put into our system from the state.
Next question from the Rivard report. Would you be able to characterize the severity of the hospitalized pediatric patients?
Characterize the severity. So that's a good question. I mean, you would think about whether they develop pneumonia or, acute respiratory distress syndrome. I do not have that data at the moment, and I think it'll be a very low number, but that's something I can focus on in our next analytic analysis. I think it is good to know what kind of complications, whether it was pneumonia or ARDS, but at the moment I don't. I'm sorry.
We have another text question from R.J. Marquez of KSAT. The 3 major school districts told KSAT today that they have not come to consensus on reporting positive cases on their websites despite the directive. Will there be discussions with those district leaders prior to the start of in-person classes?
Yes, I'm certain that the issue of reporting will be coming up in the next coalition meeting, and I know that they want guidance from us, and we want to make sure that we're meeting a proper standard, so we will be discussing that.
From the Rivard report, is there an enforcement mechanism for school districts to report their coronavirus data on their websites?
Dr. Aga explained that.
Yeah,
pretty well
at this
just a
moment,
minute
I
ago.
don't know what the enforcement mechanism will be, but it does, like I said, the amended health directive requires all public charter and private schools to report COVID-19 data. But again, the nuance is that they can post aggregate data on their website when in-person learning begins. And so it seems like we wanted to emphasize today that the decision should be at the district level in terms of how they present their data.
Do we know how much is left in the housing assistance funds, and is there enough to last up to September?
You changed gears without telling us. We have, I don't have the exact figures. We just had the presentation today. Obviously, we augmented that fund by roughly $5 million today, or we're doing that in the FY budget. We can get you an accurate number, but let me say what I said to the staff and the council today. The fixation on the number is difficult because we don't know the bottom we don't know when this pandemic is going to end. What we want to ensure is that we have an adequate amount of funding in the Emergency Assistance Fund so that we meet our standard for success. And our standard for success is that we want to ensure that someone who has been affected by COVID-19 through job loss or something else and is eligible for emergency assistance and seeks it, gets it. We don't want to have to turn anybody away. So the council is going to be working very hard to ensure that there's funding to meet that standard of success.
A group rallied today in downtown. They feared there will be an increase in homeless residents, largely because of evictions. Are you concerned about this issue as well?
Evictions and foreclosures are what we're trying to avoid. And it would be a shame on every level of government if there's a tidal wave of evictions as a result of COVID-19. A lot of these folks lost their jobs through no fault of their own, and we're trying to help.
What's happening is happening really in the JP courts, and I think we're getting some good response from our JPs with respect to eviction. We have now stopped foreclosures again for this next month. So we've taken that action, but we were precluded from preventing the landlord to move forward on an eviction. Now, there is money. We gave $9 million, I think, to the other small cities to use on programs like that. Plus, we still have several $1 million that people have not requested for out in the outlying areas. Now, you got to remember, we had that $600 little bump that everybody got a week. And so we hadn't had a lot of requests. So I would assume that we'll get more now that people are not having that extra money now, but we do have funding available for it and out in the county. The city has by far the biggest problem because they have the inner city and have a lot more poor neighborhoods to deal with than probably we do out in the county.
And it's a cooperative effort through the courts, through the council, through the court, and through our state and federal government as well. Every city and county in the nation is calling on Congress to act on the next round of relief funds for people who have been affected by COVID-19.
We've heard about the success of Haven for Hope with COVID-19. Do you know how many times they screen people or what their screening process is like?
Well, I don't know.
We had, I think Dr. Bridger was explaining that process last time she was on. We can bring that back up again. In terms of the total number of tests, though, I don't think we had an estimate on that yet.
In regards to the decline in hospitalization, I wonder in your reports, because we're hearing that some hospitals are closing COVID units, that we are seeing a decline. Is that something that y'all are aware of?
Closing of COVID units? What do you mean by that?
You know, like COVID units inside hospitals in Bexar
Like
County.
wings?
Right, they're closing them since we are seeing a decline.
Yeah, we're seeing a decline in our overall numbers. That's indisputable at this point. The number of available beds they're trying to keep steady, and that's a function of not just cases coming in, which are down, but also other cases being seen and how many staff are available to attend the beds.
You know, they do set aside a certain number of beds, and they have for COVID. So it's not unusual that they would be using those beds for something else now, because you got to remember, we had 1,267 in the hospital at one time, and now we're down to 546, which is about 700 less patients in the hospital. But they can also size right back up to do that. So just because they may be cutting back some now doesn't mean they couldn't size back up. Now we do have the 546, but you know, we want to get that down to below 100, and it's going down, but it needs to go down a little faster than what we're seeing today.
I know for a while we also were getting an update on the EMS calls. I wonder what those look like.
We do have those, and they peaked at the same time the cases peaked early and mid-July, but those have dropped down considerably as well. We're roughly at the level we were in April in terms of COVID EMS calls.
Do you know what that was?
Well, just I mean, it changes day to day, but just for instance, yesterday we had 21 transports through EMS for COVID-19 and 35 calls for COVID-19. And that's well below where we were in July.
Mayor, on a separate note, today you posted on social media about the San Antonio Postal Service machines that are set to be removed. Can you talk about this issue?
The judge can talk about it, and in fact, we'll have the DA here tomorrow to talk about it.
Yeah, we'll have the DA here tomorrow night. I'm not sure at this point what he has released yet, but I know he's working on a deal of challenging the federal government on that, because no one has a right to interfere with a person's right to vote. And no one has the right to do things that would stymie mail-in ballots. So I'm not sure. I know he's looking at it in terms of what are the legal responsibilities of a local entity to make sure that doesn't happen. As you know, the guy that went in there started cutting everything right away, and I think we lost 3 sorting deals here, and then limited on overtime. So I know the DA is looking at that, and if he hadn't made an announcement what he wants to try to do, I guess he will pretty soon. But he'll be here tomorrow night. You can ask him about it.
Well, Judge, I wanted to ask you, because right before we came in here, he had sent out a letter saying that he made an inquiry to the AG
Yes.
about his legal grounds and jurisdiction to prosecute federal officials who I mean, what do you think about that inquiry?
Well, yeah, you do have it. I have the letter here. I just didn't want to say it until I knew that it was really out to the media. I would imagine that the Attorney General is going to be really interesting to see what he has to say about this, because it's very clear in the election code that no one has the right to interfere, to attempt to subvert or manipulate the election process by illegal means. And, you know, some of us believe that's happening, or possibly happening, and you have to get down to the case to find out. And part of that is threatening to disrupt the timely delivery of mail-in applications and ballots, and that this is also coming at a time where we're facing the COVID crisis. So, yes, you have a copy of it then. Yes, he'll be here tomorrow night if he wants to talk about it a little bit more.
My comments were supportive of our U.S. Postal Service to draw attention to the fact that we take them for granted. It's an essential service. People rely on it for prescription medication. They rely on it, obviously, for voting. They rely on it to make bill payments and to receive paychecks. So we can't take that for granted, and you know, we need to do everything we can to draw citizens' attention to this and what may be happening in the U.S. Postal Service as a result of some of these changes.
Thank you.
Thanks, everybody.
Yeah, you did put it out.